I am Brandon Crowley, the Chief Data Officer for the City of Cincinnati. Back in here, and I'm sorry, let me move back on. We're going to talk about tracking heroin overdoses in Cincinnati. Back in August of 2016, the Chief Performance Officer and myself were in Chicago. We were working on an analytics project. And we received a call during our visit in Chicago that over a 3-day span of time, there were over 30 heroin overdoses. After 6 days, the number of incidents spiked up to 174. And what we wanted to do, we wanted to be able to track what was going on in our community. So we decided that we would build a visualization off of the EMS data runs that we would have, and that would give us an idea of how or what areas in our community the heroin overdoses occurred, so we can begin to strategically address how we could tackle this problem. So what ended up happening is that we built a dashboard that breaks out the heroin incidents by neighborhood, the year in volume, over the year in volume, the day of the week, and the transport outcome. And the reason why this was so important for us is because it would allow us to actually strategically deploy roving medics, identify hotspots in the Cincinnati community. It also helps us to identify some trends, and I'll kind of talk on that briefly after we take a look at our Insights portal, and also provide general awareness of what's going on in our community. Here's a beautiful picture of the city of Cincinnati. And now we're going to go ahead and transition over to the Cincinnati Insights dashboard that we built out. So our visualization portal is called insights.cincinnati-oh.gov. And when you land on this page, there's a variety of links that you can go and take a look at of what's going on in the city of Cincinnati. This site was actually designed around our city manager, Harry Black, the priority goals, which are safer streets, growing economy, thriving and healthy neighborhoods, innovative government, and fiscal sustainability and strategic investment. So the heroin dashboard is one of our most popular ones, outside of the fact that we have a snowplow tracker that if you are familiar with Cincinnati, when it snows a great deal. And when people are looking for where is my snowplow tracker, we built something so that people can see that we were being preemptive with how we were addressing whether we were brining the streets a little ahead of time before the snow would come, or just plow our streets. So our most popular visualization, although we haven't had a chance to use it that much this year because it's not been that much snow. Although I will say, Friday afternoon in Cincinnati, it was 70 degrees. Saturday morning, it was snowing in Cincinnati. So, yeah, we have some interesting weather outside of just the heroin overdoses situation. So this is our visualization for our heroin tracking that we built out. And as you can see, we have a number of categories where people can go and take a look at what's going on with regards to heroin overdoses that have been reported in the city of Cincinnati. We have our incidents here, so you can click over a neighborhood and it will drill down into the types of activities that were going on in the East End. And if you actually look on my left, yeah, that would be your left as well. The left side of it, we have the total number of incidents, and we even break it down by the time in which the incidents occurred. And so what this helped us to figure out, well, what are the hot spots in our community? And Now we can actually strategically deploy roving medic units so that they can be in those hot spots. Also, it helped us to increase our public safety presence and enforcement by actually taking a look at the incidents and try to determine where and how we needed to respond. A couple of other things that we identified with our use of data is that we also found why we were exhausting our Narcan supply. So what was happening is that as we were administering Narcan, some of the individuals who were administered that substance, they would actually wake up and become very violent. And some of the transports we weren't making because they refused transport services. But there was another cut of heroin that was growing in use in our community, and therefore at times we actually had to administer double doses of Narcan. So obviously as those types of incidents spiked, the use of our Narcan supply went down, and over that period of time, our supplies were depleted. But we were able to identify these types of, the reasons why our Narcan supply went down, and was because of the types of incidents that were reported and the types of heroin that were used at that time. In addition to that, we noticed that the community at large was greatly interested in seeing what was going on in their community. So instead of calling their council member about what's going on, they were able to go to our Insights portal and they could tap into their particular neighborhood and they can see the events that occurred in their area. So they didn't necessarily have to depend on what the local news stations were saying or reporting. They could actually go and see specifically what's going on in Hyde Park or what's going on in Evanston. So we saw a great deal of acceptance with this visualization that we built out. We were a little bit concerned if people thought that this was glorifying, if you will, heroin overdoses in Cincinnati. And we made it very clear that it wasn't about glorifying this tragic epidemic that's going on in our country, but it was really about more of a awareness of what's going on, how it's impacting the community, and to provide measures for the community to be safe. And that really pretty much concludes my presentation today. Does anyone have any questions? Sure.
How do you protect the privacy of the individuals experiencing these issues? Specifically thinking about location fuzzing, stuff like that.
Okay, so yeah, so we skewed the Latin Allonge and we anonymized the incident location for these events. So we did not provide any personal information about the actual individual, but we did skew the Latin Allonge and the address, actual location of the incident. Yes, ma'am.
When I see this visualization, I immediately think, what can I do, or what is the city doing? So do you have plans to include that sort of narrative around the dashboard?
About what a citizen can do,
Or what is the city doing to address the problem?
Oh, okay, so what we are doing is that we're being more preemptive with where we're putting our roving medic units, obviously to address those types of things. And once we identify these hot spots, we're of course increasing our public safety and enforcement in those areas. And then obviously there's just more awareness as well in the community. Through the Cincinnati Health Department, we're doing awareness on opioid and its impact in the communities. So we're doing things like that. But from an administrative perspective, we're certainly beefing up our public safety presence in those areas, as well as just being more being champions of just knowledge and awareness about what's going on in the community and how to confront those. So whether it's through the Cincinnati Health Department or community councils, those are the types of things that are being done. Yes.
Do you have the data that you share then also with these community leaders to help the individuals, or is it more like public safety just to protect the communities around it?
So we do publish, in addition to the visualization that you see, we do publish this data on our open data portal, and I hope I'm answering your question correctly. So yes, not only do we have the visualization, but we do have the rows and columns of all of that data out on our open data portal, and actually on the Insights page, if we can go back to that. I don't know if it's actually showing. Oh. Can you go to the my laptop, please? For each of the visualizations that we have on our Insights portal, we provide a link to say to show you how to link to the actual data on our open data portal. So this is just more of a sexier look, if you will. Not that you can sexily glorify heroin overdoses, but this is just a visualization of the data.
But so you could help the overall problem of drug use. So, you know, like understanding why youth or why certain individual citizen groups would tend to use drugs and help them through social services, churches, and so on.
Well, you know, that's a very good
Because
thought.
that's the data sharing part of it.
Right, and to be honest with you, we haven't added to this particular data set yet, but those are pieces that we plan to add over time. So as we get more health center data, as we get more data from other data points within the city of Cincinnati, we plan to build that out. What happened initially was with any of our crime data, it was really about aligning with the Obama's administration of the Police Data Initiative. But we decided to take that one step further back in 2016 in August when we discovered what was going on. So from that perspective, we felt like this was at least a good starting point, recognizing that this is not the end all, but at least it gives us a good idea as to what's going on, but we can build on that definitely to make a more complete data set.
So building on that question, sorry.
No, I was
have
saying
the
I would hit him next. Go ahead.
So building on that question, do you within your organization have the analytics capability to do that kind of, to take the data that you have and to identify what those factors of risk are among those who've overdosed, and then predict where you might be able to prevent overdoses in the future?
That's a very good question. So we do have a group of analysts who are looking at these particular data points, as well as some data that we get from the health department and whatnot. But what we have not implemented at this time was the predictive modeling for this particular epidemic. We've worked with the Data Science for Social Good for a couple of other analytics projects to build predictive modeling for some of our data points, but not this one in particular. But that's a very good question. I think as it relates to what the Chief Performance Officer and Lee Tammy, who is my colleague, she kind of dictates kind of the roadmap of what we're doing for our predictive analytics projects, but I imagine that this is one of them. As well. We haven't talked at length about it, but this is certainly one that, as the attention grows, we certainly would want to keep that one on the radar. Sure. Yeah.
You mentioned that you skewed the Latin Lounge. Mm-hmm. Those are obviously the locations of where the call came in, the overdose occurred. Mm-hmm. But a lot of times people get their drugs, right? They, as close as they can, they do them right then. So have you noticed any unintended consequences by publishing this map where someone goes, right, there's a good batch going around, I want to go over there? No, I mean, I'm being serious. You mentioned law enforcement was kind of after that, if you identify areas, but if I want to hit, I'm probably not looking at a map on where everyone's dying. So But I'm just curious if you've seen people use that map to go, well, I want to go to that part of town because that's where the good stuff is.
That's a very good thought. Now, we haven't seen that happen, but I imagine that there could be some individuals that could look at this data point and say, oh, well, there must be something to my benefit, if you will, in that area. But we actually haven't seen that. So, for instance, if we had a large reported heroin overdose in Avondale, and let's just say it was 60 incidents in the month of February, have we seen over the next few months, like with 2016 data, did it spike rather in Avondale? We have not seen that. But that's a very good thought. That's a very good thought. But that's one of the reasons why we redact and anonymize a lot of our data. For instance, when it's crime incident data, we made a point not to put any rape incidents on there. Why? Because there could be some individuals who would try to take advantage of individuals who may have been victimized by rape. So that was kind of the mindset behind the data points that we were putting out there in our anonymization and the skewing of that location for that data. I hope that answered your question. Okay. Yes, sir. Okay, so that's a good question as well. The city of Cincinnati, in the city manager's office, there is a communications division within the city manager's office. So anytime when we did our initial launch of Cincinnati Insights, we had a media blitz, if you will, of that. We had a presentation of the portal. We had an unveiling of the portal. But we continue to tweet the dashboards, whether it's snowplow or whether it's new data that we're putting out there. We're getting ready to put traffic stop information out there. So we're constantly tweeting this stuff, constantly doing, from the communications perspective, media blitzes with it, as well as entertaining brief interviews with the local media so that they can get the word out. In addition, our council members are very good at making sure that people are going actually to this portal to see the data that we're publishing. So we got a pretty good holistic approach, if you will, on how we're bringing awareness to the portal that we've built.
Hey, Brandon. Couple questions. One, just made me think of it. Is this being used by the city council itself? Are they using the Insights dashboard to understand what's happening at the city? And then my second question is, have you seen any preliminary results of putting the data out there and understanding the trends? Have you seen impact from the publication of the data? Have you seen trends move in the right direction because people understand the problem better?
Those are very good questions. So the first question about council actually using this particular portal, I don't directly know if city council members are using the portal per se. I know that there are moments when we may get a call about questions about a certain visualization, but nothing concretely that people are out actually promoting the actual their specific visualization or whatnot, except for the snowplow tracker. I hate to keep going back to that one, but apparently that's the one that is the most popular. As it relates to, have we seen kind of a positive change, if you will, in our reporting of this data, and has it made a positive change in how things have changed? I could say that I don't know conclusively, to be honest with you. This is something that we're always looking at. So we have our stat procedures that with our police stat, and that we're looking at these types of measures, and that the city manager as well as the chief of police, they talk to see how we can address some of the systemic problems or issues or challenges in our community. So I know that that is one thing that we have to be very cognizant of. I am running out of my time, so I think I need to give Jim the floor. Excuse me. Did I take up too much of your time?
You're okay.
Okay.
Good.
There you go.
Thank you, Brandon. The good news, to go to your question, is that part of my task is to take the localized data from Cincinnati and bring it back up a level to the national scope. My work, National League of Cities, with my partners at the National Association of Counties, we have come at this from the national level looking downward. The silver lining, I think, that is evident in the dark cloud that is this opioids public health crisis is that cities have embraced data with a vengeance. 1 year ago now, I was sitting in a room with city and county leaders, in fact, working with some folks from Socrata, and we were working with data from the CDC, for the Centers for Disease Control and Prevention, and we were looking at the data that they had currently available, which was 2014. So it was, at that point, 18 months out of date. And we were going through, we were looking at macro trends, and the first thing that happened is all the mayors and the council members and the police chiefs and the city managers in the room started talking about what they know better than what the CDC had been discovering, because they had been tracking the data locally. They had begun to build their own portals, as you saw from Cincinnati. They had begun to work with their local hospitals. More importantly, they'd begun to work with their local coroners. Coroners, at one point, would be more apt to write death cause, drug overdose. Now they write death cause, drug overdose, combination of fentanyl, heroin, prescription opioids, alcohol. Not every coroner, but that's the trend we're going to. That's again, the way that data is being exploited to give us more information, help us make better decisions, help us learn more about this. So early on, all we really had to go on was, again, some of the macro data from the CDC. We were looking at this number of simply absolute deaths in 2014, looking at 2000 to 2014. The only thing you really get out of that is the incline of the line, right? The very steep number of deaths over time. Of course, the end result was also quite tragic. We began to see that deaths from opioids, from heroin and from prescription drugs like Demerol and Percocet and Oxycontin had now exceeded the number of deaths from automobile accidents and became the #1 cause of accidental death in America. And so that's the sort of scale and scope of the crisis we began to see. As we got more sophisticated, we started to share and compare data. This is a chart looking at heroin addiction rates per 100,000 and the number of deaths per 100,000. The pink is the number of deaths. This was the first warning sign we got, that what you heard from Brandon about fentanyl, the synthetic that had been added to heroin for an extra boost that frankly was killing people because a very small amount is all you need and really death comes quite dramatically. The other thing we had to do, because I work with local elected officials, I work with the same people Brandon works with, mayors, council members, city managers, we needed to try to bring all this data together as much as we could. We had to put it into pictures, if we could, to try to convey some meaning, a lot of detail, a lot of words, a lot of charts in a few graphic pictures. And we started building things like these. And then, of course, we got to the good stuff, right? As we got more and more sophisticated, we got to the maps. And actually, this is a map that, again, folks at Socrata helped me build. This is 2002 data. Continental United States, forgive those folks from Hawaii and Alaska, who we did not include in this map. But the blue is lower rates of heroin and opioid overdoses. The red is higher doses. Now, I'm going to show you now the 2014 number. Watch the dramatic difference in the red. All right? I'm going to do this again, right? This is 2014. I'm going to go back to, this is 2002, and this is 2014. You see the huge swath, particularly in the West and in the area around Appalachia. This is Ohio, West Virginia, Tennessee, Kentucky, Indiana, right? The best thing about this data, not only as dramatic as it is in terms of helping bring attention to this issue is it allows you to go down and look more directly by counties. These are all outlined by counties, and you see that in Kentucky, the difference between 2004 and 2014, much darker in color and more extensive. And Indiana is also another interesting place. The isolated counties here, Scott, Crawford, Vanderburgh, gave us a chance really to look and see why there. I mean, Vanderburgh is especially the one really red spot surrounded by all that blue. And so this allowed us to think more directly, to help target resources more directly. The data gives us a chance, as you all know, to make better decisions, to channel resources in a better direction, to try to target our work, and to try to focus. This is a corridor outside the men's dormitory in the Kenton County Jail in Kenton County, Kentucky. Just beyond the walls where the officer is standing is the 75 men in a pilot program. On the other wing is 35 women in the pilot program. They are delivering some of the best medication-assisted treatment programs in America, period. It is multifaceted. It provides either methadone or buprenorphine, which is the medication of medication-assisted treatment. It is peer networks within the addicts within the jail cell themselves. It is got therapeutic regime, and the individuals are taking ownership of their own addiction problems. They also make use of the highest medical technologies, a medication called naltrexone, it also goes by the trade name Vivitrol, is given to each of these individuals after their 9-month stay in this program. I should say 9 months is also another critical aspect of this. It's a long duration program, helps reduce the recidivism rate, as it were, the tendency to go back to addiction. And so they've been able to do this. They did this on their own, in the jail, with their own resources, with a former addict who is running this program. He's a remarkable man, and the leadership that's being taken here is absolutely great. States also were doing interesting things. This is Connecticut. All of the red dots are some of the early places where the state of Connecticut created a pathway that pharmacists, on their own authority, could be distributing naloxone, which is also by the trade name Narcan. It's this opioid antagonist that if you give it to people when they're having an overdose, it brings them back. We use this map to try to begin to target where the pharmacies were doing this in cities and in towns. This is some of the private pharmacies, that is, say, independent pharmacies, not some of the chain stores. And so we were able to begin to plot that. Other states have also embraced this as a particular habit. Pharmacies have been great partners in this with cities and with providers of service. Pharmacies have great data on the kind of prescriptions that are written. They also are places where people are going. Safe disposal boxes for syringes, for needles, and of course, most importantly, for the excess prescriptions that you and I all have in our medicine kit, right? We go and we get dental surgery, we get 14 Percocet, we take one, we leave the remainder in the medicine cabinet. Why are so many young people dying, the 18 to 24 cohort? Because they're taking it out of their parents' medicine cabinet, bringing it to school and mixing it with their friends. It all needs to go back in boxes like this. In pharmacies, CVS, Walgreens, independent pharmacies, also city halls, county halls, fire stations, police stations. They're all putting these boxes in. Manchester, New Hampshire has been a great example, very city hard hit by this. They got a great award from the Robert Wood Johnson Foundation. Their culture of health, their safe stations program, all moving in this direction. But education is really what we need, right? Lots of data, but we've got to help people understand it. We've got to help people synthesize it. We've got to wake people up to some of the challenges. This is an ad from Erie County, Pennsylvania. They created, in a shopping mall, a mock-up of a teen bedroom. Hidden in plain sight, it was called. And it was an attempt to show parents the kinds of telltale signs that their children might be susceptible to addiction. And it was a way to wake up parents to some of the work that they might be able to do to help stop this early on. But of course, we know in the end that this is an issue that takes people working together. It takes a lot of folks driving to solution. It's important that people realize that they're not alone. And the way to help do this is to talk about it, to be champions, to help destigmatize addiction, to talk about addiction as a disease and not a criminal behavior. And of course, I get to work with local elected officials every day, mayors and city council members, some of the folks in Cincinnati, for example. And the best thing I can do really is close my part of the program by letting you actually hear from one of them. This is the mayor of Huntington, West Virginia, city of 50,000, Stephen Williams. He has been a champion for city leaders. He was on our opioids task force. Take a listen, it's 2 minutes.
The level of addiction was so high in my community that no matter what we were doing, that we truly could not arrest our way out of the situation that we're in. And I was also finding that it wasn't just Huntington, it was the entire nation. We knew that we had to do some things to take ownership locally, to define the problem locally, and refuse to be defined by the problem. Fact is that any one of your council meetings, somebody sitting out there is fighting the problem. It's everywhere. It's not down the street. It's not somewhere else. It's everywhere. And if you have been given the compliment by people in your community by electing you to serve, then you have an obligation to lead. Imagine you just reach out and take my hand. And when you take my hand, then you try to let go. Because there's going to be some point where somebody's going to get scared, tired, fed up, and just say, I quit. What we're saying to those who are in recovery in our community, you don't ever have to worry. We're not ever going to let go. We're going to be standing by you, holding on. Even when you're at your weakest point, we're going to be standing there holding on to you. That's what they're saying in the peer-assisted treatment program, is that when they're standing together and then holding on to one another, when one starts to get weak, holding the other up. That's what all of our communities have to be able to do. That's the assurance that we have to give to those who are living in our communities who are fighting this.
That's a man I get to work with every day. I am the luckiest man in the world. I love my job at the National League of Cities. I thank you very much for your time. I take note that we are at 1:15. The clock is here telling me we have 3 minutes. If you'd like, I'm going to let Brandon finish up and have one last thought, because he'll bring it back down to the micro level in Cincinnati. Thank you for your kind attention.
Thanks, sir. So in Cincinnati, one of the things that really impacted what we were doing was that we just saw what was going on in our community. And, when we were away in August, when this whole epidemic just started to rear its ugly head in Cincinnati, we couldn't, first of all, we were shocked. I mean, in Cincinnati, we would typically have 20 to 25 heroin overdoses in a month. And over a span of 6 days, there were 174 of them. And it was just absolutely ridiculous. And there was nothing that we could do at that time, me and the chief performance officer at that time, but we said, we have to bring some insight to what's going on. And that's what was the motivation behind building not only the heroin dashboard, but our insights portal. Mr. Black, our city manager, wanted more than just rows and columns of data. What he wanted was for the community to be able to see what types of things are going on. And with the heroin overdose dashboard, that's exactly what we're getting. But I think you guys raised some very good points, and that is, outside of increasing our public safety presence and outside of increasing enforcement and increasing the roving medics, what can we do more with regards to, hoping to rehabilitate and just connecting more data points to it? So I think you guys raised some very valid questions, and it's something that I'm going to get back to my shop with the performance officer and certainly start to build those things out. So I thank you even for your input this morning. It has been invaluable.
Please give our technical staff a hand. We had a very complicated program, videos, and out on the internet, so they did a wonderful job. Thank you so much for your help.